Greetings from Johannesburg, South Africa. Let me welcome everyone and say good morning, good afternoon, or good evening, depending on where you are. I'm Sheila Clow, co-chair of the Nursing Now Global Campaign. It has been a great experience being one of the leaders of this successful campaign. Now, allow me to thank everyone who was involved. My fellow co-chair, Lord Nigel Crisp, who's with us here, the Nursing Now board. One of our young people who is in the board member is right with us here, Monashe. The Nursing Now Secretariat under the leadership of Barbara Stilwell, who's with us. Colleagues at the ICN, and we have the president right here with us, and WHO, and also you, the nurses of Africa, and the global community of nursing. I want to thank you, my colleagues, for your critical role during the COVID-19 pandemic. We lost so many of you. Many people lost their lives, yet you continue to lead on the front line. The pandemic brought nurses into the spotlight and showed you as a formidable force that can take care of humanity in all crises and in all settings. It is now time for the world to invest in you as agents of change for universal health coverage. The Nursing Now campaign has united us, and the launching of the Nursing Now groups in the various countries was very inspiring. It reached 126 countries in 3.5 years, and we saw the success of the Nightingale Challenge, whereby over 800 employers provided development opportunities for over 31,000 young nurses and midwives. Now, in today's event, the Global Footprints of Nursing Now campaign, we are actually traveling across the world from east to west. We actually started at 6 a.m. Central African time, and we will end at 8 p.m. So we are going through the 6 WHO regions and sharing stories, as well as looking forward to how we build on the momentum of the campaign. Remember, it's not yet over. We have only just started, and we do have the full energy to go on and to build on the legacy of the Nursing Now campaign. Now, my fellow co-chair, Lord Nigel Crisp, is just a great human being, a great believer in nursing, and a proponent of community-based health solutions. It has been very inspiring working with him and in this campaign, but actually, it has more of a historical perspective in that we come from afar as former champions of WHO's Global Health Work Alliance. So when he said to me, let's do this, I said, Nigel, I am with you. So Nigel, let me invite you to deliver our Global Nursing Now message.
Thank you so much, Sheila, and what a pleasure it is working with you, and a great treat to be here with you in Africa. I think we've had a great 3 years moving things forward, and there's more to come, as you've already said. Let me also just mention the 2 board members from Africa, the 2 other board members from Africa, Francis Omazwa from Uganda and Munashi Nyake, who you've already mentioned, from Zimbabwe. So Africa's been well represented. Let me also mention the members of staff, Barbara Stilwell and Catherine Irwin and Hannah Finch, who are managing this marathon of meetings. And this is, I think, number 4 following the sun around the world. But you know, it's great to be in Africa, even if only virtually. And Africa played a big part in the starting of Nursing Now. Before we launched the campaign, we had a very important meeting here in April 2017, hosted in fact by Francis Omazwa and the African Platform for Human Resources. And then once we did launch the campaign, Uganda, Tanzania, Kenya were all very fast off the mark in terms of creating Nursing Now groups and joining the Nightingale Challenge subsequently. So Africa is a very big part of this campaign. And I'd like to congratulate and thank all the nurses everywhere for everything they've done during this campaign. But let me, even during the dreadful year of the pandemic that has taken such a toll and is still taking such a toll, and let me pay tribute to nurses and health workers everywhere for your magnificent work during the pandemic. We all owe you a great deal. Now, I say thank you for what you've done in the campaign, but also for what you will do. The campaign is ending, but as Sheila has already said, the work continues. I think we've helped bring people together and create a platform for change, but there's much more to do. You can actually read about the campaign in our report, which I'm holding up here, called Agents for Change, which is actually available on the Nursing Now website, and it tells something of the story of what's happened everywhere. But what's really important is that there's a legacy. Again, Sheila, you've already mentioned this. More specifically, there are three things happening globally: the ICN and our great partners, and lovely to have Annette Kennedy with us again today. The ICN are taking forward the links with Nursing Now groups globally. The World Health Organization, our other great colleagues and partners, are taking forward the Nursing Strategic Directions document, so nursing will still be on their agenda into the future. And the Nightingale Challenge, which you mentioned earlier, is becoming the Nursing Now Challenge and will last for at least another 2 years, which is great news. And perhaps even more importantly than all that, that's the global stuff, but nationally, it's what happens in towns and cities and villages and clinics that really matter for the future of nursing and for the future of improving health. Now, we set up this campaign because we believe that one of the biggest things we can do to improve health globally is to empower nurses, to raise your profile and status, and enable you to work to your full potential. I believe this even more strongly now at the end of this campaign, and believe there will be increasing opportunities for developments in the next few years. Change is happening, and nurses are agents of change. And when we look back in, say, 5 or 10 years' time, I'm sure we will see how far we have come. But let me leave you with one final thought about the future. I think it's something that Africans understand even better than Europeans like myself. And that's this: our health as individuals is intimately connected with the health of our communities, and intimately connected with the health of our society, and ultimately with the health of the planet. And it's an idea, I believe, that should guide us for the future as we carry on this great work. So once again, congratulations and thank you for everything you have done and everything you will do in the future.
Thank you so much, Lord Nigel Chris, for those great words. As you said, change is happening and nurses are agents of change. Now, it is my pleasure to introduce our keynote address by a sister and a good friend, Her Excellency Toyin Ojora Saraki, founder of the Wellbeing Foundation Africa, to combat the global scourge of preventable maternal and newborn deaths. Through the Wellbeing Foundation Africa, she contributed to the State of the World's Midwifery Report and the Global Reproductive, Maternal, Newborn and Child Health Strategy 2.0. Now, I call her the lady with a foresight because about 5 years ago, I participated in her campaign in Nigeria on keeping hands clean. And literally, she was going around in schools and making sure that children wash their hands. Now, how very relevant and life-saving in this very COVID-19 era. Madam Toyin Saraki, over to you.
Thank you very much, Professor Sheila Tlu, my dear sister, and a big welcome to everyone. To go straight to the point, William Shakespeare once said that the meaning of life is to find your gift, and the purpose of life is to give it away. So I'd like to begin by celebrating every member of the Global Frontline, and to take this time to highlight the contributions that nursing, that most caring of professions, and nurses, the most caring professionals, have bravely made in fighting against the coronavirus. Today's convening serves as an important and very timely occasion for us all to recognize each of you and to reaffirm the very fact that life would not have and cannot continue without you. Despite the unprecedented events that emerged at the start of what was set to be a promising new decade, nurses across the sub-Saharan continent have remained present, have persevered, and continue to concretize the path which identifies, invests, and esteems nurses and the entire frontline at large. Through your constant on-the-job learning and progress, You've actualized the very nature of being multifaceted and ready for any and all action by acclimatizing to a challenge that you did not see coming. To me, that is the very proof of a man and a woman bringing the front in the front line to life. In this particular year of the health and care worker, we've seen renewed levels of commitment and a revised clarion call that has sought to prioritize diagnosis, prevention, care, and cure daily. You have clocked in and out of hospitals, general practitioners' surgeries, healthcare facilities, and primary care trusts, despite the recognized risks and the ongoing resistance to respond to your calls for remuneration. At each juncture, you have remained, each of you, truly deserving of the resounding acknowledgement that you've all been given this year. So we use today and every subsequent day to signpost the power that lies within going beyond oneself and the reality of health delivery being actualized right up till the last mile. At each juncture and with every peak and trough of the pandemic in mind, the maintenance of optimal health and well-being in the lives of every male and female nurse and midwife has also been a journey. The WHO records that the total health workforce in Africa currently stands at 1.64 million people, of which health service providers, including nurses and midwives, are not enough, as many as you are. Each one of you has strengthened and validated the data that we so desperately need in order to move further into the new normal, and you've solidified the need for further investment in the directions of upskilling. Your diligence, your selflessness, your ability to continue to see positivity on the horizon is admirable, noble, and resilience personified. Building back better as we continue on the road to a post-COVID-19 world, we know that nursing shortages and the variation in age of the existing workforce must be considered, supported, and welcomed. The ICN estimates that up to 13 million nurses could be needed to fill the global shortages and replace the nurses who will leave in the next few years. How will we manage this and make health worker resilience and fulfillment a priority? By continuing in the vein of community, a community which starts in the very facilities and faculties that each one of you administers care from. The journey to achieving optimal care outcomes begins in the home, and by us acknowledging our own very friends, neighbors, colleagues, and peers as nurses. Them and us are our first patients, so please be good to you. As we usher in a new generation of Florence Nightingales, it is imperative that we invest in nursing education in our countries and around the world as the continuous pipeline to train the next cohort of the formidable frontline. I celebrate both nurses and midwives today. You are the voices best suited to lead us to a more optimal, equitable, and further resilient future for healthcare and for our lives. We will continue to clap, cheer, commend, and console every collaborative contribution, all while welcoming, hearing, and seeing firsthand examples of the continued empathy, resilience, the rising beyond risk, and the boldly bouncing back from mass bereavement that you have done as nurses repeatedly. Because of your nursing contributions, we now have a fuller frontline force today. Thank you, and thank you.
Oh, thank you so much. I wish we could go like this. Anyway, we are going like that. Thank you, Mr. Toyin Saraki, for those inspiring ways, especially the call for education, investing in education, in job creation, and better working conditions for nurses. And you did touch something after our own heart, Lord Nigel, Chris, and I, the fact that what our friend Francis Omaso always says, that healthcare begins in the community. Hospitals are for repairs. Definitely nurses have a role in there. It is my privilege now to introduce the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. He is hosting the health ministers at the virtual World Health Assembly today, but we are delighted that he has actually sent us a special recorded message. So let us please watch.
Excellencies, dear colleagues and friends, and nurses around the world. Over the past 3 years, Nursing Now has played an extraordinary role in raising the profile and status of nurses on the global stage. The campaign has pushed countries towards action, developed a new generation of nursing leaders, and increased the influence of nursing in health systems globally. Last year, Nursing Now, WHO and the International Council of Nurses came together to develop the first State of the World's Nursing Report. The report highlighted significant global shortage of nurses and provided policy options for countries to leverage the full potential of nurses to support the health of their communities. The COVID-19 pandemic has been especially hard on nurses, many of whom have been at the forefront of the crisis for well over a year. Thank you so much for your continued determination and commitment. As the Nursing Now campaign comes to an end, I urge countries to invest in nurses so they are supported, protected, motivated, and equipped to deliver safe care. That includes endorsing the new global strategic directions for nursing and midwifery at the World Health Assembly this week. My special thanks to Lord Nigel Crisp and Professor Sheila Tlu for the leadership they have shown as co-chairs of the Nursing Now Global Campaign Board. Nursing Now may be ending, but our work to support nurses and countries continues with the same commitment. I encourage countries, healthcare employers, and nurses to engage in the Nightingale Leadership Challenge. We have 2 more years to reach the target of training 100,000 new nurse leaders who will have a positive impact on their communities for many generations to come. Now more than ever, we need the dedication, the skills, and leadership of nurses to deliver care and to deliver a healthier, safer, fairer, and more sustainable future. I thank you.
Thank you. Thank you very much, Dr. Tedros, for your message and for your support for nursing and midwifery. We are inspired by the fact that we'll still be having that support during the Nursing Now challenge. So we will still be with you. And now, it is my pleasure to call upon my sister from another mother, Miss Annette Kennedy. She is the president of the International Council of Nurses and a global leader for us nurses around the world. She is the one with whom, before the COVID-19 lockdowns, we traversed the boundaries of many countries, supporting nurses and speaking to ministers of health and other partners. A true inspiration. Over to you, Annette.
Thank you, Sheila. Thank you, co-chair. And don't forget, I got an invite to Botswana and you're going to kill a fatted calf. So I'm keeping you to that. Good morning, good afternoon, good evening, wherever you are. Excellence, Cervica, Lord Crisp, Elizabeth Ero, I think is there, the Nursing Now board, Barbara, Francis and Asha, hello, and greetings from the International Council of Nurses and the 27 million nurses around the world that we represent. Today, I have mixed feelings as we celebrate the end of the Nursing Now campaign. I am proud to see what Nursing Now has achieved in its 3 years and sad to see it finish. Alongside WHO, ICN has been a proud partner of the most successful global nursing campaign the profession has ever seen. Nursing Now has energized the profession and brought encouragement and visibility to the nurses when they most needed it. It changed public perception and demonstrated clearly to political leaders the high quality healthcare. I'm not sure they've quite got that yet. I think we have a lot of convincing to do on those political leaders. It's a profession the world simply can't afford not to invest in. Collectively, we at ICN, WHO, and the nurses will carry on the legacy of Nursing Now with pride through leadership, working groups, and political influence. The collaborated efforts of Nursing Now with WHO and ICN has already proved very successful. Our chief nurse, Elizabeth Eero, was appointed. But of course, we need chief nurses in every region and chief nurses in every country. And we will continue that fight. Working together on the first WHO State of the World's Nursing Report, and finally on the WHO Global Strategic Direction for Nursing and Midwifery, which we hope will be adopted at WHA this week, has been a great achievement. Over the past year, all our efforts, both collectively and individually, have been on supporting nurses through this awful pandemic. The Story of Nursing Now campaign, Agents for Change, is a wonderful testimony to Nursing Now achievements and a great legacy. ICN is delighted to take forward the nursing groups, many of whom are linked to our national nurses associations, or led by them. Susan Williams, who researched together with Nursing Now, has undertaken many conversations with the groups over the last 6 months. And we have had them on our webinars to talk about the strategic direction. And also we have had them in our discussions with the independent panel for pandemic preparedness. And we have established a working group with the Nursing Now groups to work through the nursing and midwifery strategy in the future, because it will only be through nurses working together to create different models of care to meet the needs of society that equitable healthcare will be achieved. As you know, 80% of nurses are suffering mental health issues. And as I was already said, ICN estimates up to 13 million nurses will be needed to fill the global nurse shortage gap in the next few years. Government's recognition of this tsunami that's coming down the tracks. Without nurses, there will be no health service. ICN is encouraging governments not just to adopt the WHO Global Strategy for Nursing and Midwifery, but to implement it as a priority if they want to save world health systems and society. Nurses should never again be expected to nurse patients with a deadly virus without appropriate protection and support, and governments have a duty of care to their nurses. Right now, we have 60 nurses attending WHA virtually, continuing the political campaign, but they need to see action from governments, not words. No longer words are enough. We too, as a group, as a society, as nurses and as friends, build on the visibility nurses have achieved with Nursing Now campaign and during this pandemic. We have to be part and parcel of every policy-making decision. We have to be central to every strategy and task force. We have to be equal partners in health policy decision-making and not just implementers of decisions. We owe it to the nurses that died to seize every opportunity to create the opportunities and make our voice heard. The future is in our hands. Finally, I want to thank Lord Nigel Crisp, particularly for taking this campaign forward. We've had many conversations about nurses talking to themselves, about why he did take this forward, and about many other things. And I've learned a lot from Nigel. Thank you on behalf of all the nurses throughout the world for taking this campaign forward and doing so much for us. And finally, thank you to the nurses for the commitment and courage. They must be valued, not ignored. Thank you for today, tomorrow, and next year. We will be with you. We will be with you when this pandemic is over, and we will support you. Thank you.
Thank you so much, Annette, for your very clear message that change has to occur, that never again should nurses be expected to work with a deadly virus without proper equipment and support. Now, we are about to watch a film about the Nursing Now campaign. But first, we have a special message from Her Royal Highness, the Duchess of Cambridge, who, in her role as royal patron to the Nursing Now campaign, has given her time generously. We really appreciate her for that.
Although we cannot be together in person at this closing of the Nursing Now campaign, I wanted to say a huge congratulations for the incredible work that you've done over the last 3 years. When Nursing Now was launched in 2018, we had no way of knowing just how much the work, dedication, and infinite care of nurses would be tested, needed, and appreciated. COVID-19 has highlighted the vital role that nurses provide, which we all rely on, and it's made all the more extraordinary when we consider the huge sacrifices and personal demands that have been placed on all of you by the pandemic. It has been the hardest of years, and my heartfelt thanks to you and your colleagues around the world for the incredible work you do every day. This short film shows some of the amazing work that Nursing Now has been doing over the last 3 years to develop the confidence, training, and leadership potential of over 30,000 nurses and midwives worldwide. I had the pleasure of interviewing Harriet, who is featured in the film earlier this year. Her passion, vision, and dedication to the community she cares for is both humbling and inspiring. I wish you all the very best for your future work.
Nursing Now has united nurses and their allies and created a mighty movement for change. In the 3 years since Nursing Now was launched, the campaign has led to the creation of more than 700 independent groups in 126 countries, and has seen over 31,000 nurses and midwives participating in the Nightingale Challenge.
Nursing Now has opened huge opportunities by involving me in high-level discussions and meetings with global health partners, including WHO.
Over the last 3 years, I have been involved as part of the board in contributing towards the voice of young nurses.
Working with Nursing Now, I learned the importance of working together, networking, sharing, advocacy, the need of empowering early career nurses, and the importance of working with data in hand.
Definitivamente, Nursing Now nos vino a enseñar la importancia de la enfermería a nivel mundial, pero también la importancia de la necesidad de enfermeros y enfermeras en puestos de liderazgo y su participación política en los sistemas sanitarios.
The Nightingale Challenge has been a really brilliant opportunity to galvanise nurses across the globe.
Through the partnership with Badet Trust for Nursing, we are implementing our Nightingale Challenge project in Uganda, which aims at building resilience of nurses and midwives in provision of adolescent-friendly sexually reproductive health services.
It has been an exciting opportunity in being able to learn about leadership and what goes into global health decision-making.
It is very clear that no country will ever be able to achieve its goal for universal quality healthcare for citizens without investing in their nurses and midwives.
Nurses are vital agents of change who can improve health and transform healthcare. It's time to invest in nursing and enable nurses to work to their full potential. Over the next 2 years, the Nursing Now Challenge will work to reach over 100,000 nurses and midwives, inspiring the next generation of nursing and midwifery leaders across the world. Please join us as we work together to ensure access to health for everyone, everywhere.
Good morning, good afternoon, and good evening across the world. And it really is amazing to be here today as we have this global footprint. And today we have a roundtable session with leaders from across Africa that we're going to be hearing from this afternoon. And these leaders are also going to be sharing their experiences with the Nursing Now campaign. I will give our leaders and speakers an opportunity to be able to introduce themselves and also to be able to give us their speeches for this afternoon as part of this panel session. And just to remind our speakers that we've got 4 minutes each for each speaker. And if you can be able to keep within that time, And also, if you don't mind, if I will interject you as we get to the end of the 4 minutes. So in beginning this session, we'll have our first speaker, who is Ms. Judy Kanyola, who is from Kenya and currently connecting from Rwanda.
Thank you, Munashe. Good morning, good evening, good afternoon, everybody. It's so exciting to be part of this Global Footprints at the tail end of the Nursing Now campaign, which has been such a phenomenal success in my view, and so wonderful to really bring nurses and midwives together across the globe. Talking here from Kigali, Rwanda. I'm the chair for the Center for Nursing and Midwifery at the University of Global Health Equity in Kigali, Rwanda. I'm a Kenyan national by birth and have been involved in nursing and midwifery for the last 25 years, mainly in the area of education and now increasingly in supporting nursing leadership in Africa. And 4 minutes really can't do justice to what is there to say, but I just want to talk a little bit about Africa, about nursing and about education. The Nursing Now campaign has allowed for an unprecedented coming together of nurses and midwives in Africa, from Botswana and South Africa to Sierra Leone and Ghana. Over 29 out of the 54 countries in Africa joined the Nursing Now campaign and took part in various initiatives and activities in the last 3 years. We were learning from and sharing with each other our successes, our failures, our lessons, and Nursing Now has allowed nurses and midwives in Africa to begin to coalesce as a formidable entity to demand much needed change in the health systems of Africa. COVID-19 has shown us starkly the different inequities that we have in health, the inequities and the disparities that we have. And I believe that nurses are really critical in beginning to change the narrative around this. In Africa, as we look to the next decade, Africa continues to make progress. So gone are the days when they used to call us the dark continent, and we have made some substantial progress in many aspects of human development. Most Africans today are healthier, they live longer, they're more educated, and have more access to goods and services. In Africa, as in the rest of the world, there is a direct relationship between health and economics. And so when I give that brief background, nursing and midwifery sits squarely at the intersection between health and social needs. And these are critical when we're looking at determining our overall health and well-being, not only for us as individuals and our families, but to the whole population as a whole. By 2030, the nursing profession will be caring for a changing Africa. And thus, nursing and midwifery education needs to evolve rapidly to meet this need. Africa needs to prepare nurses and midwives to deal with several key issues which I'll rapidly outline. Number one, rapid urbanization, rapid population growth, a youthful population, and still at the same time, people are living longer and therefore more old people than we have been used to taking care of. The double burden of communicable diseases and non-communicable diseases, new technologies such as this one that's allowing us to come together as the whole world and speak and relate to each other, changing political environments that we have in Africa, and then also the need for interprofessional and intersectoral collaboration. All the above that I've mentioned, social determinants of health, must be integrated into the education of nurses and midwives. So to me, the nursing and midwifery footprint in Africa, thanks to Nursing Now, is indelible and will continue to show the way. Colleagues, ladies and gentlemen, I thank you.
Thank you so much, Judy. That's an amazing speech. Our next speaker will be Stefan from Ghana.
Okay, greetings to everyone joining us. I am Stefan. I'm a student nurse, final year student nurse at the University of Ghana. And I'm here to share my experience about, as a student nurse, what it has been like joining the Nursing Now campaign. First off, I would like to congratulate the Nursing Now campaign and all supporting partners for the splendid work they've done in raising the profile of nurses across the globe. I'm part of the team of student nurses that won the very first Nightingale Global Solutions Challenge. My other members, Adelaide, Emanuela, Lawrence, I'm sure they will be joining the stream. Our solution looked at challenges in neurorehabilitation in Ghana and how we could break these gaps that we find in neurorehabilitation in Ghana. We really felt empowered to take up this challenge, and I believe the launch webinar of the challenge, subsequent webinars had brilliant speakers who were truly inspirational, and they empowered us as student nurses. We're glad to have heard from the likes of Emilia Clark and Jenny Clark from CMU and how their journey has been. Of course, we also loved hearing from Professor Sheila Tulowu, Professor Lisa Bayliss, and again, Munashe, quite inspirational at the moment. Since access and cost are the biggest challenges facing neurorehabilitation in Ghana, as a team, we wanted to use telerehabilitation to provide nursing support to these patients who have had brain injuries. Presently, our solution has moved from paper to ground. We are currently writing a proposal for ethical review at the Noguchi Center for Ethical Review, and very soon we'll start taking up our challenge to the clinical side, and we'll start engaging with these patients and providing the necessary support. And I would say it has been a wonderful experience as a student. I have learned so much. I have gained so much experience, and I'm very thankful to all leaders and individuals behind the Nursing Now campaign. It has been truly enlightening, and hopefully very soon, fingers crossed, we'll be able to share the success of our solutions.
Thank you very much, Stefan. It really is amazing to be able to have you here this afternoon. Our next reflection will be coming from Malawi with Joe Conjera.
So, hello everyone. My name is John Conjera. I'm a registered nurse midwife and also a public health professional. I'm one of the 23 young nurse midwives who attended the Pre-World Health Assembly in Geneva in 2019. I'll share a bit of experience that we had in Malawi. For me personally, this has been quite an impressive campaign, because I've been able to be exposed to a number of global and local engagements, especially in the leadership. And it has made me learn a lot of things in terms of leadership skills. And I've been able to apply this kind of learning to my daily work. So in Malawi, we had the National Task Force, which was coordinating all the activities regarding Nursing Now campaign. And the activities that we had, we first of all had the launch in 2019, where we showcased to the nation through involvement of media and the nurses from across the world what the campaign is all about. And the meeting was attended by senior government officials and also representative of Nursing Now in Africa. Moving forward, we came up with the Nightingale Challenge, which focused on developing the young nurse leaders to be part of the multidisciplinary team with a greater contribution. So we identified 50 young nurses, and then we briefed them about the Nightingale Challenge. And so we identified 2 from each facility, and then we also had the mentor from the same facility. So after the briefing, they went back to their respective facilities, and they practiced a number of initiatives, including change projects. And when we did our supervision, we learned that most of the nurses are learning in terms of leadership. They indicated that they have been able to confront conflict resolution and also general management issues. The other activity that we had was the launch of 2020 Year of the Nurses and Midwives. I'm quite happy to share that the event was attended by the head of state, showing a greater commitment from the government and indeed from senior government officials. The president actually praised the nurses for the contribution that we are making, especially during the time of COVID-19 pandemic. The campaign has made us learn a lot of lessons, beginning with the presence of the nursing messages on different platforms, and also the lobbying for investment in nursing has quite been evident. And generally, the campaign has raised the status and the bar for nursing professional and nurses in Malawi. Thank you so much.
Thank you so much, Joe. Really great to hear your reflection from Malawi. Our next reflection will be coming from Uganda, and our speaker will be Harriet Naiga.
Thank you very much, Munashi, and thank you very much, everyone. I want to say congratulations to have come to this step. I cannot imagine how far we have moved with the Nursing Now campaign, and we are here to show ourselves as the true evidence of the transformation that Nursing Now has brought to the entire world. My name is Naiga Harriet from Uganda. I'm a midwife with 7 years of experience of both in clinical and community environment. I'm the director and founder of Midwife-Led Community Transformation, MILCOT, which is a community-based initiative that aims at bridging the gap which exists between the midwife and the local community through provision of sexual reproductive health and rights, focusing on prevention of teenage pregnancies and unintended pregnancies. I'm a young champion midwife for Nursing Now Global Campaign, and I'm here to share my experience right from the beginning during the 2019 when I was selected by Nursing Now and I attended the World Health Assembly in Geneva, together with the 24 fellow young nurses and midwives who are contributing immensely in health of their countries. This was an eye-opener to me. It uncovered me from where I was working on my charity, helping the young people in my country, and then Nursing Now exposed me to the entire world where I met different global health leaders, including WHO officials, who explained to us about the outstanding global health challenges, and I found where I was fitting very well. We shared experiences with the fellow young nurses and midwives, and then through the interactions with the Nursing Now global leaders, we got inspired, I grew, and I made a commitment that I have to make a difference with the journey of Nursing Now campaign. And when I came back to my country, I was energized, I was motivated, and having Nightingale Challenge team led by Professor Lisa Baylis come visit MILCOT in Uganda, that was so inspiring, that was motivating to me and the team. We had to move on with our Nightingale Challenge project that we signed up, which is aiming at building resilience of nurses and midwives in Uganda towards provision of preventive health services. And we also provide them with leadership skills, as well as centering on developing their capacity in provision of adolescent healthy services. And in this, we have trained 11 nurses and midwives coming from both government and private health facilities. We have built their capacity. We have also engaged them in provision of mental health care to the marginalized adolescents and young adults. We have placed them in a community to help them understand on how to assess community challenges, how to intervene, and we have seen them making a recommendable service in the community. And the global footprint of Nursing Now campaign, in my perspective, we are moving on with developing capacity of nurses and midwives in my community in Uganda, and this is not going to stop because my dream was not to grow alone. It was to help other nurses and midwives to grow and to be part of the problem-solving process of the country and of the world. It's my pleasure that Nursing Now has helped me fulfill this at this step, and I hope we are going to move together even throughout to the Nursing Now challenge. So at this moment, I want to say that the journey is just beginning. It's my pleasure to be part of it, and we only wish that the legacy of Nursing Now will be remembered, that we shall follow it. We shall put it as a candle for the young nurses and midwives to look at and to follow, that it will never, never die. Thank you very much, Nursing Now. You have brought a difference in nursing and midwifery professions. We are now seen. Thank you very much.
Thank you so much, Harriet, for your reflection. And it really is great to be able to have you with us this afternoon. Our next reflection will come from Ajodeji Owolabi, coming from Nigeria.
All right, thank you so much. My name is Ayodeji Owolabi. I'm a nurse and a broadcast journalist from Nigeria. The executive director and co-founder of Nurses on Air. Nurses on Air is Africa's foremost health digital media broadcasting, branding, and advocacy platform run by nurses, with the hope of protecting the image of nursing and the true value and worth of nurses across Africa. Our headquarters being in Lagos, Nigeria. When we pick up the Nursing Now challenge as a subgroup of Nursing Now, we had 4 major aims. 1, to project the positive image of Nigerian nurses. 2, to break the communication gap between Nigerian nurse leaders and Nigerian nurses. And 3, to project the worth, the work, and the contribution of Nigerian nurses using the power of digital media. Then 4, to celebrate nurses as everyday heroes. And Nursing Now was a great leverage for us to do this. As a subgroup of Nursing Now in Nigeria and as a media platform, it was easier for us to reach out to our nursing leaders and to also connect with young nurses and other nurses in Nigeria. So we created a platform which gave us the ability to initiate some projects. We initiated online national media chats for Nigerian nurses to have a chat with our nursing leaders. We cut across the Nursing and Midwifery Council of Nigeria, the National Association of Nigerian Nurses and Midwives, as well as the Director of Nursing Service at the Federal Ministry of Health here in Nigeria. We also initiated a COVID-19 story series to collect Nigerian nurses with other colleagues here in Nigeria so that we can share the best practices, especially with the fact that the pandemic, the coronavirus is new, it's a novel virus. We are not so familiar with it. So we can share best practice from Nigerian nurses that are in USA and Nigerian nurses in UK and also Nigerian nurses across Nigeria so that we can share experiences and see how we can collaborate to bring out best clinical practice. And also some set of nurses assisted in projecting the quality and worth of nurses for nurses to share their experiences, to share their view and challenges that they went through as nurse during the pandemic. Though there were some quite challenges, especially the fact that there were a lot of issues with nursing in Nigeria and also Nigeria as a whole, but we are hoping that we keep moving forward to see how we can work together and synergize with young nurses and nursing leaders to keep on improving the status and profile of nurses using the power of media. One of the documentary we shot, I don't know if the montage can be projected. We have a short montage of the documentary. Munasi, I don't know if that can be projected.
I don't think we have it at the moment.
Okay, no problems. All right, so the documentary was about nurses sharing their experience, how what they went through as a nurse during the COVID-19 pandemic. And it's maybe after this, we can create a platform for people to see it on Nurses on Air platform to see what nurses went through during the pandemic. Thanks to Nursing Now for this initiative, and we hope to bring out the best more in Nigerian nursing using the power of media. Thank you so much for the opportunity.
Sure. Thank you so much, Adedeji. And it would really be great to be able to get that documentary shared as well. And really just to thank all our speakers this afternoon with this roundtable session in which we were just sharing reflections from across the continent from an amazing group of leaders that have been part of the campaign. I really just want to thank all that have been part of the campaign and really in being able to drive involvement of young nurses across the African continent. It has been amazing to be able to see the energy that the campaign has built and looking forward to being able to push this energy forward over the next 10 years and beyond in driving and improving the status and profile of nurses across the world. At this point in time, we are going to move to a video from the Nursing Now campaign in Uganda. Thank you so much.
Catherine Betio-Deke is my name, National Coordinator Nursing Now Uganda. Since the launching of Nursing Now on 22nd March 2018, Nursing Now campaign in Uganda has registered very good progress and made many key achievements in the priority thematic areas of clinical practice, regulation, education, and leadership and governance. In the leadership, we got appointed Commissioner Health Services, Nursing and Midwifery, who is known as a chief nurse in most of the countries. We developed the Nursing and Midwifery policy, which is now at its last stage for its presentation to Cabinet for approval. In regulation, we developed Nursing and Midwifery scope of practice, which is also at its last stage for approval. We are reviewing the Nurses and Midwives Act, which is ongoing. In education, many nurses and midwives have upgraded. Universities are developing specialized courses for nurses and midwives. Then nurses and midwives training curricula are being revised. Clinical practice nursing and midwifery scheme of service has been approved by public service and is being implemented. With the great support from Aga Khan University, continuous professional development courses have been conducted for young nurses and midwives. Ministry of Health also has supported and sponsored in-service training for 400 critical care nurses. Leadership and governance, more nurses and midwives are involved on policy development table. Nurses and midwives leaders who are involved in all task force committees of COVID-19. And Nurses and Midwives Federation has been registered, which is Nurses and Midwives Association. Research committee has been formed to look into ways that research and scholarship capacity for nurses and midwives can be built better. And now younger nurses and midwives are actively driving innovative health initiatives. Thank you.
Thank you so much for that video, and thank you for sending it, and for all your support and enthusiasm throughout the campaign from Uganda. It's been really quite humbling to all of us. I also want to thank you, Menashe, for the wonderful roundtable session, again with so many young nurses. What an inspiration these young nurses are, so full of energy and ideas. Makes me feel really quite old just watching you, but so glad that you're there, so inspired by you, and so thankful that you'll be helping us into the next era as we start to recover from the pandemic and rebuild our health systems. So thank you so much for that. We think that Sheila has, her internet may have dropped, Sheila Clow, but she will come back. Oh, wait a minute. No, I can see her. She'll come back in a minute. Yes, she's there. So let me first of all introduce to you Elizabeth Ero from WHO, the Chief Nursing Officer from WHO, whom it's been my privilege and pleasure to get to know for the last 3 years, who's been doing an amazing job at raising the profile and status of nurses, certainly within WHO and around the world. And Elizabeth, we stand in awe of you. You are truly one of our heroes. And thank you so much for being on our, you won't all know this, but Elizabeth requested to be on all of the sessions today, which is amazing. So we thank you so much, Elizabeth, and over to you. The floor is yours.
Thank you very much, Barbara. I think it's been a real privilege for me to hear the voices from our young nurse leaders and our colleagues across the world, and most especially those young leaders in Africa. You know, I kind of want to say thank you, Barbara, to you for coordinating this, and especially to Sheila Talau and also to Lord Nigel Crisp for their leadership in this campaign. It's just been fantastic. I think the team at Nursing Now needs to be congratulated for such a wonderful last 3 years and for a wonderful event today. It's just been amazing following this global footprint session. So thank you very much. I think the Nursing Now campaign has for sure ignited a response from nurses in the African region. We just heard them, and as well as all over the world. It has prompted efforts to raise the status of nursing and amplify the importance of their roles and contributions to universal health coverage. Current nursing and midwifery shortages are greatest in the WHO African region. Without significant investments in nursing and midwifery education, employment, and retention, these numbers will not change much by 2030. Recruitment and retention of nurses and midwives where they are needed most in underserved and hard-to-reach communities remains a pervasive challenge for the region, particularly in rural and remote areas. But I'm so excited to hear the positive messages from our young nurse leaders in our roundtable from the African region. Gives me a lot of hope for the future. And of course, we cannot do this alone. And we urge governments to invest and protect our nurses and midwives to future-proof our health systems. Nursing Now was a key partner of the International Year of the Nurse and the Midwife, which further increased the visibility of nurses in a year designed for celebration and positive advocacy. But the spotlight fell on our global nursing workforce for a very different reason indeed. As COVID-19 spread around the world, we faced the greatest challenge our profession has ever seen. Overwhelmed by the pandemic, our communities around the world drew strength and support from our established national and global connections and networks, and nurses were able to share their realities and lessons learned. It has not been easy. The response and actions alongside those of our health and care workers around the world have shown the world the critical role nurses have in healthcare systems. But despite the challenges posed by the pandemic, in 2020, the World Health Organization launched the first ever State of the World's Nursing Report, which has informed the global strategic directions for nursing and midwifery, and where a few of our speakers today have made reference to. Again, Nursing Now is a key partner in this development of these documents. And this week, the strategic directions for nursing and midwifery will be presented at the World Health Assembly, where a resolution on nursing and midwifery will be presented. This will be an important consideration for health ministers. This will be an important tool as each country prioritizes its implementation of policy options for strengthening nursing and midwifery in your countries. These documents have provided a roadmap for strengthening nursing going forward and midwifery going forward, It has provided a series of recommendations and policy options to strengthen our profession. It covers areas of education, employment, leadership, and service delivery. Now, WHO designated 2021 the International Year of the Health and Care Workers, and its theme to protect, invest together echoes the legacy of the Nursing Now campaign to strengthen nursing for universal health coverage and to continue to elevate the status and voice of nursing and midwifery in health for all. We must continue to work together in every country to ensure that nursing is not just for now, but fit for the future. The Nursing Now Challenge and our young nurse and midwife leaders is sure to light this next chapter. I thank you.
Yeah, well, thank you very much, Elizabeth Iro, for those wonderful remarks. I think we now have exhausted our speakers. Barbara, are you the one coming in to close?
Certainly, I will. Yes, Sheila. Are you going to close the actual event? Do you want me to close the whole?
Close
event?
and I'll close the close and I'll close the event just for a few ways because we still have a little bit of time. Yeah.
Okay, good. Well, thank you for asking me to close. That's an unexpected privilege for me this afternoon in this session. And it's been a great honour to be able to be with you all this afternoon and to hear these amazing speakers from all over the African subcontinent talking about nursing. And, you know, when I think about where we've come to in nursing, it is that we are now able to have these conversations. We are now able to have people acknowledge the contribution that nurses are making. And of course, that's partly because we've become more visible in general, because of the campaign and the activities of our partners, ICN, WHO, over the last 3 years. And of course, State of the World's Nursing and now the strategic directions, we're right up there in international policy making. But of course, and sadly, it's also because of the pandemic and the way that nurses have been visible often because of the stresses and strains they've suffered during the pandemic. The nurses we've lost, the nurses who've been sick, and the many nurses around the world who provided care to patients to help them recover, sometimes sadly at the end of their lives. Nurses have been involved in testing, and they will be involved as people go through convalescence to become again healthy, especially following long COVID. Nurses are there every step of the way, and indeed always have been. But one of the issues facing nursing is that it's often just not been acknowledged for the level of care that nursing is given. And I believe that the Nursing Now campaign has helped nurses everywhere begin to articulate what it is they do and what is the contribution that they make. And as my boss, Lord Nigel Crisp, says, we've made a step change. We've started to change the narrative so that nurses can present. And indeed, we've seen in one region today how nurses did present to their Minister of Health the data that they had collected to say, invest in nursing. We need, as Elizabeth Iro said, we're going to need more nurses. We're short of nurses. You have to learn to keep the ones you have and recruit the ones that you want into the workforce. And you can only do that if you give nurses decent work, decent salary, decent conditions. So those are the things we've been raising our voices for in the last 3 years. And today is bittersweet. It's the last event of Nursing Now, but it's not the end, as so many speakers have said, because the Nursing Now groups now have a new invigorated life with ICN. They will be talking with ICN. They'll be looking at, indeed, many are included in this week's World Health Assembly, and they'll be looking at more ways in which they can be involved, they can maintain their advocacy profile with ICN and with WHO. And of course, the Nightingale Challenge will continue as the Nursing Now Challenge, led by Lisa Bayliss-Pratt. And it's going to continue to recruit young nurses. So these young nurses who are at the forefront of the workforce, they're going to be given these continued chances to develop their leadership skills, to feed into policy, and to be able to speak outside nursing to people who are not nurses and articulate the important messages that we have about the value of nursing, that nursing is a best buy. And unless you invest in nursing, you're not going to have a health system, because nurses constitute the majority of the health workforce. So my message to you as we close this session is that we have seen the power of acting together. We've seen the power of raising our voices, of creating networks, of learning together. Let's keep those voices loud. Let's keep those networks strong so that we don't lose the momentum that we have built over the last 3 years. I look back at our journey together with enormous pride. You know, you out there, you groups, you young nurses, you've made me proud every step of the way. I've been really proud to say that I've been the Executive Director of Nursing Now. And I would love to see you go on to flourish, to become leaders of the nursing profession, you young leaders. And I'm looking forward with excitement to what we can continue to achieve together. I really do believe that this is our moment. This is the moment when nursing really changes and can step up and support Elizabeth Ero to implement all the recommendations in the strategic directions for nursing and midwifery. And I look forward to seeing it, to supporting you where I can. I want to thank you so much for being on this journey with me, and to wish you every good thing for the next steps. Over to you, Sheila.
Thank you so much, Barbara, for that inspiring speech. And I really want to also thank Elizabeth Ero for being with us. I know you are very busy because of the World Health Assembly, but let me just say that we support you, and we are looking forward to the outcome of the discussions on nursing now. And we'll be right there to assist in the implementation, in the advocacy, and really in ensuring that nurses do know about them. Now, I want to thank each and every speaker that we had today. I'm sure all of us will agree that these were very powerful speakers, and their messages were very clear. Some of them being nurses need proper equipment, good working conditions, appropriate education, and job creation. And that unless this happens, the world will be short of about 6 million nurses by 2030. Now, for me, I want to conclude also, just like Barbara, by focusing on our future, the very young nurses who have been encouraged by our 2 young board members, one of them being Monashe, who just shared the last session. They've been encouraged to be vocal and active. And I want to say to the experienced nurses, to the older nurses out there, that these young nurses need mentors so that they can learn and develop, and they should be encouraged to sign up through their employers for the Nursing Now Challenge, which will give them opportunities to develop their leadership skills and understand their role in policy formulation. And we should not even limit it to that. For me, being a politician, I really would like to see more nurses going up for that political post and really saying we want to be there where the decisions are made, that very top post where all the decisions and the legislature, everything is made. So with that, let me simply say that we are pleased to close this session and to invite all of you, to those who have gone in, to say, well, okay, this has been the closing of the Africa session, but we do have Europe, and then we have the Americas coming. So do please get in there and be able to participate, because as the saying goes, we are together. One world, one nation. Yeah. Thank you very much.